On this week's edition of Best Docs Network, we'll feature head and neck surgeon Dr. C.T. Nguyen, oral surgeon Dr. Paul Metz, plastic surgeon Dr. Lucian Ravella, bariatric surgeon Dr. Robert Marvin.
It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are changing people's lives.
Exactly right, Candace. This is the place to come to find the right doctor to help your needs. Like our first best doctor, it's Dr. Robert Marvin.
The gastric sleeve or laparoscopic sleeve gastrectomy is a weight loss operation, which means we make little incisions, do the operation on the inside with a camera. Physically is a tapering of the stomach down from a big bag that will hold lots of food to a skinny tube that won't hold as much food.
My health was deteriorating. I was so big. I was just having such a problem. I was up over 500 pounds. And I tried to do this, I tried to do that, go to the gym, do this, and those bad eating habits would always come back.
An ideal patient would be someone with a body mass index over 35. About 5% of the population in the United States is morbidly obese.
It got to the point where I wouldn't go eat with my buddies. My guys would be like, hey, let's go eat. And I was so embarrassed to wear the uniform and be that big for people to look and go, wow, you know, what's that guy gonna do? And it embarrassed me.
Officer Schultz was super obese. His body mass index was about 71 at 553 pounds, I think he was before the surgery. Statistically speaking, there's virtually no chance he would live to a normal life expectancy at that weight.
I went in weighing 554, and I remember watching the pounds from there. And for that first week, I want to say I lost like 29 pounds that first week, and I was like, wow, here we go. And it was just a steady decrease after that. I had to go through so many uniforms over that year, because I want to say the first year I lost about 150, 180 pounds, somewhere in there.
With the sleeve operation, he's lost over 300 pounds, I believe. So his extra body weight had decreased over 3/4. That put him in a much safer body mass index, and he can expect not to develop some of those medical problems or not have them progress that we would otherwise anticipate with him. And I think he's looking at living more of a normal life than he did before.
If you're going to do the surgery, have the right mind frame. Go in there, do it for the right reason, and use it as the jump. And it'll work. I mean, it's worked flawlessly for me. I feel healthy. I'm able to run down bad guys. So, I mean, I feel like a police officer again.
Keith had severe sinus problems until he met Dr. James Ludwick. To find out more about Keith's story and other life-changing stories, log on to bestdocsnetwork.com.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have colds all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
After undergoing a mastectomy, Colleen turned to Dr. Evan Feldman to help change her life. To find out more about Colleen's story and other life-changing stories, log on to bestdocsnetwork.com.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
The Best Docs Network is all about doctors that are changing people's lives, and our next best doctor is doing just that. It's plastic surgeon Dr. Lucian Ravella.
Sharon, she is special in the sense that she was having a hysterectomy in addition to a tummy tuck. So she's, again, had children, had some loose skin, and wanted to have that improved, and had the opportunity to do that at the same time as she was having a hysterectomy.
When I first came to see Dr. Ravella, it was when I was about to have another surgery done. I was going to have a hysterectomy done, and it was something that I was very passionate about. I had tried to lose weight and couldn't get rid of the stomach bulge, so I came to see Dr. Ravella and the staff.
Typically it's someone who's finished their childbearing who will come to us for a tummy tuck. And they might have excess skin that overhangs on the bottom of their tummy area, around the belly button and below. They might have some stretch marks. We remove the excess skin, and then by lifting up that skin, we see your whole rectus muscle, which is the solar plexus. And by pulling those together with suture, it can become firm, like to bounce a quarter off of it.
I was completely impressed with how much caring he has for his patients and the staff has. Everybody was very supportive. Each woman had a different recommendation of what made their life easier or what they've seen patients have an easier time with.
She's now several months out, has lost several sizes, and in addition to the result of the surgery creating a improved body contour, it's actually inspired her to lose more weight on her own, so she looks even better.
I definitely feel like I have had a new lease on life, that I did definitely have a jump start. I feel more confident. This was done completely for me. I didn't do it for anybody else. And in my line of work, that definitely helps to be able to go out and speak confidently to individuals. So it has improved my confidence tremendously.
Hypertension, this is a bad disease. It causes two main problems, strokes and heart attacks. Neither of those are good. What are the magic numbers in hypertension? Well, 120/80 is normal, At 140 over 90 and above, we call hypertension. When you're at 160 over 110, that's when we get upset and need to become aggressive with our treatment. When you get to be 180 over 120, that's when we really get upset, and that's the time to go to the emergency room for urgent or emergent treatment. What can you do to prevent hypertension or to treat it once you get it? Well, weight loss is the most important thing because being heavy is one of the biggest risk factors for becoming hypertensive. Also, lowering the salt in your diet is a good idea. You can use the DASH diet, D-A-S-H. You can find that on the internet anywhere. Getting adequate sleep and adequate exercise will reduce your blood pressure also. They say that emotional tension causes hypertension, and that is true. So relax and enjoy your life, lose weight and exercise, and your blood pressure will come down.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas in majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall cost significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Every woman is, a little bit different on one side than the other, but after I got pregnant and I had my daughter, I was breastfeeding her, and she would only take from one side, which was my left side. I guess because of that, it made that side so much smaller.
Mandy came to us initially asking for breast augmentation, and after doing an exam and taking photos, it became obvious that she had a really big discrepancy between her breasts. And after further questioning, she told us that she had to wear 2 bras and was putting something on the other side to balance it out. And there was a large difference. And it was a confidence issue. It was a clothes issue. It was being able to get into a wedding dress that fit issue. And so there was a lot more going on than just a simple breast augmentation.
Probably an A cup, maybe a small B on the left side, and then on the right side I was like a full C. And so there was a huge difference there, and I didn't feel comfortable looking at myself in the mirror. I couldn't find bras to fit.
And I said, I'm here to make you happy. I'm going to take care of you, and we're going to do everything we can to make you happy. And she did indeed need a lift. We put in different size implants to account for the different sized pre-existing breasts.
The hospital staff was wonderful. He was wonderful. He made me feel completely comfortable, explained to me, exactly what we were going to do and what was going to happen. And
It's not just about the size of the breast, but it's the confidence and the balance, that she's no longer thinking that people are looking at her and noticing that she has a 2 sports bras on, or noticing when she goes out and is doing something that her breasts are uneven.
You know, I'm getting married on Friday, and I had, you know, there's healing and, you know, all this process you have to go through, and I wanted to be completely healed. I wanted to have no pain, you know, and everything like that. So that's why I chose to do it a few months in advance.
You know, everybody has subtle differences, but some people have more than subtle differences, and that's where a procedure like this is perfect, where it can correct those differences and really help people have confidence and self-esteem to know that they are filling their clothing out that's designed in a certain way.
Don't forget, for more information on any of the great doctors you see on today's program, head to the website bestdocsnetwork.com. That is bestdocsnetwork.com.
That's right, and now we're going to meet our next best doctor. It's Dr. James Ludwick.
People go for snoring, but they need to figure out if they're treating snoring, if they're treating a real medical problem, like sleep apnea, so that they treat the cause of their snoring instead of the noise.
Dr. Ludwick's in-house state-of-the-art sleep lab allows him the opportunity to evaluate his patients in a comfortable setting.
Well, people don't come see me for a test, okay? They come see me because they feel a certain way, and they don't want to feel that way anymore, or they don't want to have this symptom like snoring anymore. They don't. Testing is a means to an end. It's a means to understand what is going on with you so that I know how to treat you, okay? So we have to have the test to know if I'm treating someone who just makes a noise or someone who actually has a medical condition that causes heart attacks and strokes, and as you saw in the nightly news, if you watch the nightly news, increased chance of cancer now. So it's a real medical problem. So I do the testing. The testing is necessary for the treatment, okay? Once we decide that you need treatment, let's say for sleep apnea, then we got to figure out how we're going to treat you. You know, there's lots of different treatment options. You know, there's surgical ways to treat sleep apnea. There's non-surgical ways, and it just depends on the person, their anatomy, and their overall health status. Which way that we want to help them. And the good thing about coming to an ENT that does sleep is that sleep apnea is an upper airway problem. You know, it's not a lung problem. Okay, you don't have a lung problem. You have a can't get the air to your lung problem. Yeah, and so that's why it's good to go to an ENT, because then we can address all the anatomic issues you may be having, because these guys have other things like deviated septums or big turbinates or big tonsils or huge palates, big tongues, things that we can help surgically manipulate those structures so that they're not causing obstruction, or if they are causing obstruction, cause less obstruction. And that's the benefit. And also use these other non-surgical techniques like CPAP or oral appliances or things like that.
From initial testing and evaluation to a successful treatment plan, Dr. Ludwick provides his patients with a one-stop solution.
That's the purpose of us building a relationship. It's not something we fix in one visit, it's a journey, and we're gonna evaluate you, find out what the problem is, pick some options, and let's see how you do, and then we can always change the plan. I mean, it's not written in stone.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
I saw the potential in 3D at really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First, I got the letter that said that no problem, didn't see anything, come back next year. Then I got the phone call and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive The HER2 had a HER2 marker in it, which is can be one of the more aggressive cancers.
As we're able to page through the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find 2 very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career.
We hope you're enjoying the Best Docs Network, which features some of the best doctors in the Houston area helping change people's lives. And that includes our next doctor, Dr. Gabriel Maislos.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain. Down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
I told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight, and the clamp on the nerve are the protective covering, which we call the flexor retinaculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I started having heavier periods where I would have to, make sure that I was near a restroom, and, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, wear anything that would, have the ability to, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female. and sooner or later it will stop. But in fact, it goes on for a long time, and it interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks. So I couldn't even anticipate if we were going on a trip or, you know.
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for, 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping, but the following day almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then, I've been perfect and feel wonderful.
People who typically see me are people either have a nasal airway obstruction problem or those who are concerned about the appearance of their nose.
I had rhinoplasty done. I had a bump in my nose, and I had fallen in a store and it had swollen up, so I came to see Dr. Eisemann to make sure it wasn't broken, and it wasn't. But then we got to talking about my situation, and he told me that he could repair my nose for me.
We do an internal exam and make sure there are not other problems that have to be addressed as well, such as sinus problems, septal deviation problems, scarring from trauma, or even some congenital problems that interfere with breathing.
I've had chronic sinus problems throughout my life, and Dr. Eisemann said I had a deviated septum, and he also repaired that during the surgery. And since then, I hardly have sinus infections anymore. I have much better health.
It's about an hour and a half to do the operation, about an hour in the recovery area, and they go home. They have some packing that's in there overnight. Taping and the dressing is to get the skin to recontour, because we're working on the bone and cartilage, and the skin has to redistribute itself and adhere to the underlying cartilage and bone so it redrapes properly.
As far as recovery, he gave me an outline and directions with it. He also gave me a list of possible problems that could result from any surgery. So I was well informed, and I was prepared for the procedure and the outcome.
This is her post-operatively, her pre-operative pictures. This is probably about 2 months after the surgery, which is generally when we take the post-operative pictures, and then we have them come back, in a year later also. My
health is better, and I just feel better about myself because I know my nose has been repaired, and I like the way it looks now, and it makes a huge difference in your life.
It's probably one of the most common operations, but also one of the most difficult ones too. But it's a wonderful operation, and it has such a dramatic change in someone's appearance. Very dramatic for the patient, and very rewarding for the physician.
Well, that'll wrap up another great show of the Best Docs Network, featuring some of the amazing doctors in the Houston area that are helping to change people's lives.
And of course, for more information on these amazing doctors, you can head to the website bestdocsnetwork.com.
And don't forget, we want to hear from you. If you have a question or comment, please send us an email at info@bestdocsnetwork.com.
All right, that'll wrap up another edition. So long, everyone. We will see you next week.